we're going to check reflexes, muscle stretch reflexes, sometimes called deep tendon reflexes. And there are 3 in the upper extremity. First, the biceps. So here we want to, with our thumb, put it right on the biceps tendon. Patient needs to relax, and then we tap on the thumb. You want to look at the muscle. A lot of young, healthy individuals may not have, especially in the upper extremities, oftentimes not much in terms of reflexes. It can sometimes help, probably as a distracting maneuver, to ask patients to clench down with their teeth, bite down hard, and sometimes that can bring it out just a little bit. Now for brachioradialis, first let me just show you the brachioradialis muscle. Pull your thumb to your shoulder. So there we can see the muscle, and then here's the tendon. And we want to be tapping on the tendon, not up here on the muscle. So relax. And so you can put 2 fingers here on the brachioradialis tendon, and there you can see we get a little bit of elbow flexion. And again, the key thing here is to see, are they symmetrical or not? Okay. So we're getting about the same degree of elbow flexion on both sides. So those are both C5, C6 reflexes. Next we can check triceps. This can be done a couple of different ways. I prefer just to have the patient, you lift up their hand with the arm really relaxed, and you tap on the triceps tendon. You can see we get some extension there, and we can do the same thing over here. The other way of checking the triceps reflex is to ask the patient just to completely let their arm relax on your hand. Here you can see the triceps tendon. And again, we get some nice elbow extension there. Triceps is predominantly a C7 muscle. There's a little C6, even a little C8 in triceps, but it's most strongly C7. And then one that we don't check routinely, but it can sometimes be helpful, especially if we're looking for upper motor neuron findings, is the finger flexor reflex. And so finger flexion is a C8 T1 function. So we ask the patient to curl their fingers in. And when I do that, I can feel the flexion. You can see a little flexion of the thumb. What we're looking for, if this were an upper motor neuron finding, is a spread of reflexes. So this goes up to C8 T1 of the spinal cord. And if we've got something upper motor neuron, it'll spread to larger areas. And when we tap here, we'll also get flexion of the elbow. And if we see that, that's an upper motor neuron finding. But here we just get a little bit of finger flexion. That's normal. All right, in the lower extremities, of course, we check the patellar reflexes. So you really want the patient like this with their feet dangling. It's much easier to appreciate the reflex. So you can put your finger on the tendon. It's usually a very easy one to get. You know, you just want, when you're checking reflexes, just let the reflex hammer swing easily. You know, don't want to keep your wrist tight. You want to have a nice swinging motion so that you're just delivering just very naturally a maximum point of impact on the tendon. And again, the key thing is to compare for symmetry. All right, so that's an L2, 3, L4 reflex, quadriceps muscle. And then we check for the Achilles reflex. So to do this, you want to dorsiflex the foot just a little bit so that you can feel that plantar flexion when you tap on the tendon. Okay, so when you tap on the Achilles, I can feel the foot plantar flex, and again, nice and symmetrical.
The patient's arm is to be sort of relaxed in the patient's lap, and I'm going to put pressure on the biceps tendon in order to stretch it a little bit. And then I'm going to strike the tendon with the reflex hammer on my own finger. I should be able to feel the reflex in my hand, even if I can't see it in the muscle contracting. Alrighty. Again, for that one, you could see the arm jumping, but I could also feel the reflex myself. When you're doing the reflex, make sure that it's a quick, rapid, it's not a funk down and hold it, it's a quick, rapid tap. So we'll do that again. And again, we want to make sure that we do that bilaterally. All right. So we also want to be able to do the triceps reflex. For the triceps reflex, again, we need the arm to be relaxed, but the tendon to also be under some stretch. So we need the arm to be bent. So generally, we will hold the patient's arm out to the side and have their arm bent. And let me hold as much of the weight as I can. Okay. And again, strike the triceps tendon with the reflex hammer directly. And again, you notice a slight swinging of the arm out laterally when that's struck. And again, make sure you do the same thing on both sides. And so just relax the weight into my hand. And you notice the slight jerk of the arm outward. So finally, we're going to do the patellar reflex and the Achilles reflex in the lower extremity. So for this one here, make sure you find the patellar tendon and just relax your leg as best as you can. And the same thing on the other side. So this patient has good brisk reflexes. They're not hyperreflexic, but they're easy to see. Some individuals' reflexes are much more subtle than that and a little harder to see. Finally, we want to do the Achilles reflex. If I let the leg dangle like this, the Achilles tendon is relaxed and not under any stretch. So you want to push up on the foot so that the tendon is stretched. And it's generally easier to strike it with the back of the hammer, but you can strike it with the front. So again, just relax as best as you can. And then the same thing on the other side. Try that one more time. All right.
Slowly tap on the joint.
Going to test reflexes at this point in time, and we'll start here at the lower extremities and just have to relax, brisk, but normal. We're going to get a little bit of a cross adductor, which is this other side coming in and being adducted, and that can be normal at his age. And then we just do the ankle jerks. Do down here. Okay, just so you can see that. And to relax. It's cooing, and that's good. Okay, just try over here. And over here is normal. Looking for triceps. At this age, we're going to get triceps. Let's see if we can relax enough to do that. Okay, difficult to do.
A grade 0 reflex is no reflex. A grade 1 reflex is diminished and often requires a reinforcement maneuver such as the Gendrasic maneuver shown here. A grade 2 reflex is a normal reflex. A grade 3 reflex is pathologically brisk. A grade 4 reflex is pathologically brisk with clonus. Broadly speaking, reflex hammers can be divided into weighted and non-weighted hammers, and each type requires a different technique. For weighted hammers, use the weight of the hammer and swing it like a pendulum. For unweighted hammers, use a flicking motion with your wrist. It's important that you become comfortable with whichever type of hammer you will be using. Feel for contraction of the biceps tendon under your fingers and observe for contraction of the muscle. Feel for the brachioradialis tendon in the anterior radial part of the arm. Tap the tendon and observe for slight wrist extension and elbow flexion.
And try to relax this arm as much as you can.
Support the patient's arm and feel for the triceps tendon.
And now this side.
Tap the triceps tendon and observe for slight elbow extension. Palpate, then tap the tendon and observe for knee extension. If you are having difficulty eliciting a reflex, try performing the Gendrasic maneuver to bring out a stronger response.
Pull with your hands and bite down on the count of 3. 1, 2, 3. Okay, and you can relax your arms. And now can I get you to lie back on your back? And just relax your leg here.
Dorsiflex the patient's foot slightly to stretch the Achilles tendon.
Relax your leg here.
Tap and observe for slight plantar flexion of the foot.
Scoot back just a little bit so your shoes aren't quite on there. There you go. Perfect. Just like that, nice and loose. Okay, good.
You just put your hands down, drop your elbows, let them go loose. And I want you to clench your teeth for me and let them go loose. Same on this side, clench your teeth and let them go loose. Okay, put that leg down, bend this one, that's it, let it flop towards me. Same on the other side.
Just relax. Just let your arms go loose. The triceps, again, just all floppy. That's super. And it's just going to have a look at your legs as well. Just flop your legs out. It's like a rectangle, that's the bottom of the rectangle, that's the top of the rectangle. That's the top of the rectangle, that's the bottom of the rectangle. That's fine.
I'm going to begin by testing your biceps reflex. Now we'll move on to testing the knee reflexes. And finally, the ankle reflexes.
I'm going to go ahead and check your reflexes, so just relax for me, please. So I'm going to put that down. Good.
Next, I'm going to test your reflexes. So we're going to do your triceps first. Just relax your arm in my hand. Very good. And do your brachial. Alright, and your radial. Okay, and do the other side. Very good. Alright. Then we're going to test your patellar reflexes. So just hold your hands like that. See, you know the drill already. Alright. Very good. Very good. Alright, you can release your hands. I'm going to test your Achilles reflexes in your heel. Alright.
So first I'm going to do the biceps. So I'm going to have you place your arm just across you there, and I'm going to indirectly, so I'm going to hit my finger over the tendon here. Okay. And then we are going to evaluate the tricep here. So I'm going to have you just totally relax, let your arm go limp, and I'm going to hit the tendon just above the olecranon process here. Sorry. Okay. And then we'll do the brachioradialis. So I'll have you, maybe this one since you don't have a watch on, I'll just have you relax it across you there. And then I'll hit just above the tendon. Okay. And next we will do the patellar. Just relax. And I'll have you just push. Yep. Good. Hands are a little sweaty. Okay, and then I'm going to slightly dorsiflex to get your Achilles here. Okay, so we have 2 plus reflex.
Next, I'm going to be assessing your reflexes. I'm going to be using my handy dandy hammer here. And this is just for me to sense the reflexes in all these joints here. That's the bicep. I'm going to do your tricep. Okay. I'll do on this arm. There we go. And the tricep. Okay, perfect. Next, I'm going to be doing your knee reflexes. Okay, perfect.
So to demonstrate reflexes in the upper extremities, just relax your arm. I'm going to tap on your reflexes. Okay. Just relax this arm here. Okay. All right, same thing over here. Okay. Just relax this arm here. Okay. Reflex here, if I just use the trommler and just do a light tap here. Right, so you get a reflex like that. If I use this tomahawk here, I have to strike pretty hard to get the same kind of reflex. But, you know, there are normal reflexes there, so even with a light tap, you can still get it. The key points, whichever hammer that you use, is that the fatter end is for adults and the pointier, smaller end is for children. So that's the normal design of the hammers. The other thing with the Achilles reflex that I think is good to demonstrate, all reflexes, as we said, are better across a flexed joint. And so it's easy on an Achilles reflex if you just tap like this and you can't tell if there's a reflex there or not. But what I usually do is I'll just apply a little bit of gentle pressure on the Achilles by stretching it a little bit, and then I'm holding it with one hand and I tap with the other hand. and you can see it and feel it push down in a delayed way, and clearly that reflex is present. And you can do the same thing with the tomahawk here. Just a little bit of gentle upward pressure on the foot, and that puts a little bit of tension on that Achilles tendon so that when you strike it, you'll get a nice reflex. And you can place your thumb on the biceps tendon, you just give it a nice strike here, and you can see their arm move visibly on their abdomen, and you get a nice biceps reflex that way. So similarly for the patellar reflex here, if their legs are straight and you tap on the patellar tendon, you can't really see anything. So the simplest way is to turn the leg out just slightly and then bring it up into a slightly flexed position. And then you've got a slightly flexed joint here. I usually will support the leg with my opposite hand, and then you just tap lightly on the patellar tendon and you see a nice patellar reflex there.
Testing the reflexes assesses the reflex arc and the supraspinal influences which operate on it. If the tendon of the stretch muscle is gently struck using a reflex hammer, the muscle briefly contracts. Begin by testing the reflexes in the upper limbs, the biceps, the supinator, and the triceps. Then go on to test the reflexes in the lower limbs, the knee jerk and the ankle jerk. In patients where reflexes appear to be absent, you should ask the patient to grit their teeth or clench their hands to see if this reinforcement results in a reflex jerk. In patients where reflexes seem abnormally brisk, you should test for clonus by briskly dorsiflexing the foot. If clonus is present, the foot will continue to jerk backwards and forwards.
I'm going to check your reflexes, so just relax. Relax.
We'll just take a look and let it go nice and loose. And this is the brachioradialis, and you can see how nice and perfect that is. So really that's all you need to do unless somebody had neck pain or weakness on one side of the arm, showing that the reflexes are normal. In the lower extremities here, let it go loose. And we still can generate a reflex. And we have reflexes nice and normal down here. Reflexes are 0 if they're completely absent. If we couldn't get it the first time, we can distract people. And this is a grade 1. So for example, if I couldn't get the reflex here, I could ask her to take your hands and pull them apart. And then if I could get the reflex, that would be a grade 1. And that's called the Gendrasic maneuver. But her reflexes are normal. In patients with muscle disease, if they're getting very weak, eventually you'll lose the knee reflex because the muscle is just too weak to generate a reflex. But in clinical practice, we really only need to do the brachioradialis, knee jerks, and ankle jerks. Ankle jerks are lost early in neuropathy and lost late in myopathy in the knees.
And now your reflexes, just let your hands flop.
So I'll look for the patellar reflex, L234, just straddle that patellar tendon, maybe put just a little support beneath the leg. It tends to bring out the reflexes nicely. The reflex hammer should be used in a very kind of a loose whip-like action. And find your target, compare sides, and that's L234. The S1, the ankle reflex, is best done if you just take one finger, lightly preload that Achilles just a little bit, and you're kind of tenting those toes down, and again, a very light action. I'll try to get out of the way of the camera, but just like that, again, compare sides.
So we're going to check on the upper limb, we're going to check at the bicep, and also down at the wrist. Okay, so Abby's nicely making sure that we can get to that region first. So if you could just slightly flex your arm, please. Okay, that's great. So I've found the bicep tendon, and I'm going to strike directly over it. Okay, so we've got a good reflex there. We're going to do the same again on the opposite side, making sure we're comparing one side to the other all the way through. And striking directly down, and we can see that contraction. And then we're going to check down near the wrist, so if you just relax for me. Perfect, and same again. Excellent, so we've got good reflexes there. We now need to have a look at the knees, so if we just uncross your legs, please. Okay, and just relax for me. Get nice, loose and floppy. And we're just going to check over the patellar tendon. Okay, so we've got a good reflex there, and then on the opposite side. Okay, so we've got a slightly brisk reflex there, though. So we're just going to have a look at the reflex of your ankle. So just let me move your leg, please. Stay nice, loose and floppy. I'm going to strike the ankle. Excellent, and relax for me. I'll do the same again. Nice, loose and floppy. Brilliant, we've got an excellent response there. Terrific reflexes there.
And so I'm just going to test your reflexes now. So I still want you to go lovely and floppy, and I'm just going to use this. It doesn't hurt. Okay, so try and relax. Okay, same the other side. Okay, and relax. Brilliant.
I'm just going to tap your arms. Okay, so if you go nice and loose for me. Okay, and go nice and loose on this side, lovely. Okay, if I could get you to swing your legs around for me. So next thing we're going to do, I'm just going to test your reflex. That's all right. So 1, 2, 3. 1, 2, 3. There we go. And 1, 2, 3. Okay, that's lovely.
And just relax. Good. Okay. Okay. Relax. Try to relax as much as you can. Good.
Good, just keep your arm loose. Good. 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 Nunca. Okay. Good. Okay.
Triceps tendon. Good. Relax as much as you can. Good. Good. Just like this.
to have you relax. Can you count 1 to 10?
Yep. 1, 2, 3, 4, 5, 6, 7.
Just a little bit of a reaction here. Okay, again, can you count
1, 2, 3, 4, 5, 6.
A bit of reaction. Okay, and then I'm going to do your ankles here. So relax. Okay.
You could just let your arms be loose and by your side. Just let your arms just drop down. Very good. Okay, just let your legs be nice and loose. And test your ankles.
We'll just go ahead and start knocking out our reflexes. Let your jaw just fall and relax. Jaw jerk, that's checking a reflex at the level of the palms. I'm going to drop down. Get the biceps, C5, 6. While I'm here, I'm going to get the triceps. Let it fall. Just relax, just relax, just relax. C7. I'm going to get brachioradialis, again, getting a C5, 6. Okay. What I can do is come on down here. I'll watch the move of her thumb. And you're really dropping to get a C7, 8. Another way of testing it would be watch the movement of the thumb when I flip her finger. And of course, if there's any signs of hyperreflexia, the thumb really jerks excessively when I do that. Okay? And then you're sort of in, as far as reflexes go, no man's land. Of course, you can do abdominal reflexes, checking the upper and lower thoracic levels. The anal wink checks S1. Other than that, you're in no man's land until you get down to the knee, L2, 3, 4. So we come down, we check L2, 3, 4. Okay, if you ever get some asymmetry, put your hands together and pull. Pull, pull. Okay, called the Gendrasic maneuver, just distracting. And pull. And pull. If you ever can't get an ankle jerk, do this. Push down against my hand like you want to go 1 mile an hour in the car. And all you're essentially doing is making them relax because they tend to help you. When you want to lift the foot up, they tend to hold their foot up. When they hold their foot up, you don't get an ankle jerk. Okay, push down 1 mile an hour. And 1 mile an hour here. Good.
I want you to be nice and relaxed, okay? Good. Nice and relaxed, that's great. Just like you're doing. Perfect. Nice and relaxed. Good.